if you wake up tomorrow and you've got a knee that feels like it's, I don't know, grinding on glass, or maybe a hip that just completely locks up every time you try to stand.
Right. Your immediate instinct is just to stop.
Exactly. Common sense tells you to rest it, protect the joint because clearly it's wearing out. It's a very logical thought process.
It seems logical, yeah.
But what if treating a painful, a quote-unquote bone-on-bone joint with pure rest is actually the fastest way to guarantee it never works properly again?
That is the million-dollar question.
Right. What if your knee pain isn't even, inherently a knee problem to begin with?
And that really gets to the heart of a massive misunderstanding about how our bodies age.
Yeah.
We tend to view our joints like tires on a car, You drive on them for a few decades, the tread wears down, and eventually, well, you just need a replacement.
A completely mechanical view.
Exactly. But biological tissue just doesn't work that way. It's not passive. It is a highly responsive living system.
Which is wild to think about.
It is. When we treat joint decline as this inevitable mechanical failure, we completely ignore the actual environment that is causing the joint to fail in the first place.
Okay, let's unpack this because that is exactly the paradigm shift we are looking at in today's deep dive.
Yeah, it's a big one.
We are diving into two really detailed practical management guides from N5 Digital and IsoTone.
Mm-hmm.
And these are authored by Dr. Lev Moten.
Right.
One guide is entirely dedicated to the hip and the other tackles the knee. And our mission today, the reason you're listening to this, is to pull out the most actionable insights from these texts.
To give you a real shortcut.
Yes, exactly. We want to help you build what the author calls a maintenance layer for your body.
A proactive layer.
Right. This is about active daily care to preserve your mobility, ideally way before you hit some kind of, a total crisis point.
And we should definitely establish right off the bat that these guides, they are not anti-medicine.
Oh, absolutely not.
Yeah, they're grounded heavily in the author's scientific background. They don't suggest you, skip a necessary surgery or ignore your doctor if a joint is truly objectively beyond repair.
Right. If it's broken, it's broken.
Exactly. Instead, they're trying to fill this massive gap in how we handle daily physical maintenance because most of us we passively wait for a doctor to fix us when things completely break.
We're terrible at preventative care.
Right. So these guides provide a structured method for the other, 99% of your life.
So let's get into the core ideology here, because it really fundamentally challenges the popular narrative around osteoarthritis.
The whole wear and tear myth.
Yeah, we hear wear and tear thrown around all the time. But I have to ask, playing devil's advocate for the listener here.
Sure.
If someone looks at their x-ray, right, and their doctor points to this massive loss of cartilage and the narrowing space in the joint.
The classic bone-on-bone image.
Exactly. Isn't the cartilage the actual problem there? The image literally shows a worn-out hinge.
Well, the x-ray shows you the consequence. It does not show you the cause.
Okay, explain that.
Think back to the car analogy. If you look at a car with a failing suspension system, you might look down and see a completely bald tire.
Right.
Now, the bald tire is a real problem. But if you just swap in a brand new tire without fixing the alignment or the shocks...
The new tire is just going to go bald, too.
Exactly. The guides argue that cartilage acts the exact same way. It is just the victim of a poorly managed environment.
Ah, I see.
The concept here is what the author calls the whole joint process. A joint doesn't just deteriorate in a vacuum.
It's not isolated.
No, not at all.
Yeah.
Every single second you are standing or moving, that joint is being held, guided, protected by this massive support network.
Muscles, tendons.
Muscles, tendons, fascia, and even your nervous system.
So if I am, say, sitting at a desk for 10 hours a day,
right,
and my muscles just become super stiff and uncoordinated.
They basically go offline.
Yeah, so they stop acting like a suspension system.
Yeah.
They're forcing that poor cartilage to take the brute force of every single step I take.
That is the exact mechanism. When that supportive tissue is neglected, when it gets tight or weak or neurologically just kind of asleep, the joint is abandoned.
Wow. Abandoned is a strong word, but it makes sense.
The space between the bones physically compresses because the muscles aren't providing any lift. There's no tensegrity.
So over years of taking that unbuffered impact, the cartilage just eventually breaks down.
Right. And this brings us to a really, really crucial takeaway from the text. Numbing the joint is not the same thing as restoring the joint.
Oh, that makes a lot of sense.
Yeah.
Because if you just take an anti-inflammatory pill, you're really just turning off the alarm system.
Pulling the battery out of the smoke detector.
Right. You might feel great for, 4 hours.
Right.
But the structural compression, that bone grinding on bone, it's still happening.
You are just grinding down the cartilage with a smile on your face.
That is a terrifying mental image.
It is. You are hitting the pause button on your awareness of the damage. Pain relief alone just leaves the joint totally unsupported.
Still carrying all those destructive loads.
Exactly. But if you combine pain relief with the maintenance layer we are about to discuss, then you actually create a runway.
A runway to actually improve things.
Right, a runway to improve the mechanical environment of the joint itself.
Okay, so if the cartilage is just the victim of a bad environment, it sounds like we really need to look at the structures creating that environment.
We do.
Where does the real heavy lifting for the lower body actually happen? Like, where do we start?
The absolute command center for the lower body is the hip.
The hip. Not the knee, the hip.
The hip. It is the perfect place to start our breakdown because the architectural support system there is just massive.
Right.
And a malfunction in the hip cascades all the way down through the rest of the leg.
I think most of us just picture the hip as this simple ball and socket, like a joystick on a controller.
Right, a very basic mechanical joint.
But the guides redefine it as this deeply complex, load-bearing web.
It's an incredible piece of architecture.
Yeah. I mean, you have the gluteus medius on the side, which the text says is critical for keeping your pelvis level.
Super important.
And then you have the gluteus maximus for pure power. And then underneath all of that, which I didn't even realize, you have these deep rotators.
A deep six, yeah.
And they act like guy wires, just constantly micro-adjusting the femur bone inside the socket.
To really understand how critical that web is, just think about what happens when you take a single step.
Okay.
When you lift one foot off the ground, your entire body weight shifts. If your gluteus medius is weak or tight, your pelvis physically drops on that unsupported side.
Oh, wow. So you're literally lopsided.
Exactly. And to compensate for that drop, your thigh bone rotates inward.
Which sends a twisting force down the leg.
A twisting shear force all the way down your leg.
So to fix that shear force, we have to maintain that whole muscle web.
You have to.
And the guides introduce a really cool visual mapping system for this. They use green zones and red zones.
Yes, the traffic light system, basically.
It seems like the core of the whole IsoTone method relies heavily on this map. So let's look at the green zones first. The author calls these tissue reservoirs.
The green zones are basically the large, fleshy muscle bellies.
The meaty parts.
Right. These are the areas where active intervention like massage and targeted strengthening actually yields the best results.
So for the hip, where are we looking?
For the hip, we are talking about the lateral hip, which is where that gluteus medius lives. We are talking about the posterior hip, the meaty part of the gluteus maximus.
Okay, the side and the back.
Yep. It also includes the upper hamstrings and the proximal adductors, which is the inner thigh region.
So those are the shock absorbers you want to actively maintain.
Exactly.
But then the map also strictly defines the red zones. And these are the sensitive structures.
The places you want to leave alone.
Right, the rule here is complete avoidance. So for the hip, that's the groin crease, the front hip crease where the iliopsoas runs.
Yeah, very sensitive area.
The direct interior of the joint and the greater trochanter, which is that bony knob on the outside of your hip.
Right, you can feel it right on the side. What's fascinating here is the philosophy of restraint in these guys.
The restraint.
Yeah, the text states that wisdom often means knowing what not to press.
Which is so hard for us to accept.
It really is. We have this deeply ingrained no pain, no gain mentality.
We think if something hurts, we need to just dig our knuckles or like a rock-hard lacrosse ball directly into the epicenter of the pain.
I think we have to break it up.
Right. Which usually just leaves you bruised and in way worse shape the next day.
Absolutely.
Why does digging into those red zones backfire so badly? I mean, physiologically.
It's all because of the neurology. The red zones are highly, highly concentrated with nerves, and bursae...
Wait, what are bursae?
They're these little fluid-filled friction sacs that cushion the joint.
Oh.
They also have dense connective tissue. So if you aggressively grind into a tender bursa on the side of your hip, your nervous system interprets that as a literal attack.
It thinks you're being injured?
Exactly. It triggers a protective reflex, causing all those surrounding muscles we just talked about to spasm and guard the area even tighter.
So you don't get a release at all?
No, you get a lockdown.
That is a brilliant way to explain it. You are trying to coax the nervous system into relaxing the suspension, but instead you are just tripping the security alarm.
Perfect analogy.
And if that suspension system in the hip is totally locked down, the knee below it is absolutely going to pay the price.
The knee is entirely at the mercy of the hip.
Entirely.
Entirely. If that gluteus medius we talked about isn't working and the thigh bone is spiraling inward with every single step, the knee joint gets twisted in a direction it was just never designed to go.
It's basically a hinge, right?
Yeah.
It only wants to go one way.
Right. You cannot meaningfully resolve knee pain without fixing the hip that actually steers it.
Okay, the knee guide really blew my mind because it forces you to stop thinking of the knee as just a dumb hinge swinging forward and backward.
It is a highly active living system.
Yeah, it is guided from the top by the massive quadriceps on the front of the thigh. It's supported from the back by the hamstrings.
And anchored from below by the calf muscle.
Right. The calf manages the shock wave of your foot hitting the ground.
It's a whole chain. And the kneecap itself, the patella, it actually floats inside the tendon of the quadriceps.
Wait, it floats. It's not attached directly to the bone.
No, it sits in this tiny groove on the thigh bone, floating in the tendon.
Oh, wow.
So if the lateral muscles of your quadriceps, the ones on the outside, are tighter than the medial muscles on the inside, they will literally pull the kneecap off its track.
Like a derailed train.
Exactly. So when you bend your knee, the bone grinds against the edge of the groove instead of gliding smoothly down the middle.
Which perfectly explains why the knee map has its own specific green and red zones.
It does.
The green zones for the knee are those major cables we mentioned. The large bellies of the quadriceps, the hamstrings, the calf, and the soft, fleshy margins around the knee.
The tissue reservoirs.
Right. And the red zones are the structures that are suffering the consequences of those tight cables.
Exactly.
So the guides strictly forbid aggressive massage on the quadriceps tendon just above the kneecap, the patella itself, the patellar tendon below it.
The direct joint line, the medial and lateral ligaments on the sides, and the hollow pocket behind the knee.
Okay, I really have to pause here because this goes against almost every instinct I have.
I know, it's counterintuitive.
If I go for a run,
Yeah.
right, and the tendon right below my kneecap is just screaming, my immediate impulse is to sit down and rub that exact spot.
Of course it is.
But the guide is telling me that's a red zone. Why is touching the actual site of the pain a bad idea?
Well, let's go back to our car analogy.
Okay.
If your car's suspension is rigged way too tight, the tire is going to rub against the wheel well and squeak. Massaging the patellar tendon is like hitting the tire with a wrench to try and make the squeaking stop.
That's totally pointless.
It is. The tendon is inflamed because the massive quadriceps muscle above it is chronically tight. It's pulling the tendon taut like a guitar string.
So the tendon is really just the messenger.
Yes.
It's screaming because it's being yanked on by something else entirely.
Precisely. If you rub an inflamed, overtension tendon, you only increase the friction and the inflammation.
You're just irritating the messenger.
You are. You have to go up the chain into the green zone, into the belly of the quadriceps.
Ah, I see.
You release the tension in the muscle, which introduces slack back into the tendon, and then the pressure comes off the joint line naturally.
Okay, so we have the maps for the hip and the knee. We know we're hunting in the green zones to create slack, and we are treating the red zones like, laser tripwire.
Exactly. Do not touch.
But the real question is application. How do we actually intervene in these green zones without triggering that nervous system lockdown we talked about earlier?
Well, that's where the texts detail the IsoTone method.
Okay.
It utilizes a specific tool designed with two distinct modalities. You have vibration and you have static pressure.
And I imagine they're used in a very deliberate order.
A very deliberate sequence based on how tissue actually responds to stimuli, yeah.
Let's look at the vibration mode first. The guide describes this as a broad, warming, softening phase. But, what is physically happening under the skin? Are we just shaking the muscle?
No, it's deeper than that. You are communicating directly with the nervous system.
Okay, how?
There is a well-known physiological principle called the gate control theory of pain.
Gate control.
Right. Broad, non-threatening vibration travels along nerve fibers faster than pain signals do.
Oh, really?
Yeah. It essentially crowds out the pain signals reaching your brain. It closes the gate.
That is fascinating.
At the same time, the vibration causes local vasodilation. Blood vessels open up, bringing warmth and oxygen to the area.
So it's flushing the area with nutrients.
Exactly. It signals your parasympathetic nervous system to drop its defensive guarding.
It reminds me of preparing the soil in a garden before you try to dig into it. You have to soften the entire environment first.
That's a perfect way to visualize it.
And once that area is awake and receptive, then you can transition to the second mode, which is the static, slow pressure.
Right. Because while you are applying that broad vibration over a green zone like your quad, you will inevitably find a specific, stubborn knot,
Trigger point.
a trigger point that feels like a dense rope. That is when you switch to static mode. You apply focused, sustained pressure directly into that tight point.
But the guide uses a very specific term here, which I loved. It calls it quiet pressure. So
Yes,
this isn't about mashing the tool in as hard as you physically can.
definitely not. It is about ischemic compression, followed by a yield.
Ischemic compression.
Yeah. When you apply steady, moderate pressure to a muscle knot, you temporarily press the blood out of that tiny area. You hold it there, breathing calmly, until you feel the tissue begin to melt or yield beneath the pressure.
Like butter melting.
Right. But if you press so hard that you are, like, gritting your teeth, your brain will recognize it as a threat and reflexively tighten the muscle.
Back to the security alarm.
Exactly. The pressure must be invited by the body. It cannot be forced upon it.
That is such a crucial distinction for people to understand. It shouldn't feel like a punishment or, a test of your pain tolerance.
It's a negotiation, not a fight.
I love that. And this leads to what might be the most surprising part of the whole protocol.
Step 4.
Yes. You find the green zone, you use the vibration to prepare the soil, you use the static pressure to melt the knots, but you weren't done.
Not at all.
Step 4 in the guide's mandates that you have to move immediately afterward.
Because the massage simply creates a window of opportunity.
A window.
Yeah. If you release the tension in your hip, right, and then immediately go sit on the couch for 2 hours,
I'm guessing that's bad.
your nervous system will just reset the muscle right back to its original shortened length.
Oh, because you haven't given it a reason to stay loose.
Exactly. You haven't taught the body how to actually use the new slack.
So for the hip, the protocol suggests getting up immediately and doing some easy walking or glute bridges or sit to stands.
Yes, simple functional movements.
And for the knee, doing slow step-ups or just practicing unweighted bending and straightening.
You are fundamentally reprogramming your movement.
So you're locking in the changes.
You are performing what's called a proprioceptive reset. You are showing your brain, hey, look at this new range of motion we have. Look at how smoothly the kneecap tracks when the quadriceps aren't yanking on it.
That is so smart. That movement cements the soft tissue work into your actual gait,
It seals the deal.
which bridges us perfectly to the ultimate phase of the maintenance layer. The guides use this phenomenal phrase that really anchors the whole concept.
Oh, I know the one.
Massage prepares, strength protects.
It is a brilliantly simple, closed-loop system.
It really is.
The exact same green zones that you just massaged to relieve tension are the exact same muscles you must train and strengthen to prevent the tension from returning.
So by releasing the tight quad, you allow the muscle fibers to slide properly.
Yes.
Then, when you do a squat or a lunge right after, the quad can actually generate force to protect the knee, rather than just pulling the kneecap out of alignment.
And that strength is what holds the joint in a better configuration over the long haul.
Because weakness causes the tightness in the first place.
Exactly. Weak muscles have to stay chronically tight just to keep you upright. Strong muscles actually have the capacity to relax when they aren't actively working.
We should definitely clarify what this looks like in a practical routine, because people might be picturing hours of work.
Right.
The guides are very clear that consistency beats intensity. We are not talking about a brutal hour-long physical therapy session every single day.
No, 5 to 10 minutes of targeted, regular maintenance is vastly superior to a heroic, aggressive session once a month.
Just a few minutes a day.
The goal is daily continuity. A few minutes of soft tissue release to manage the daily accumulation of tension, followed by purposeful strengthening a few days a week.
And daily walking, obviously.
Yes, walking is non-negotiable.
So to synthesize these two incredibly comprehensive guides, whether you are dealing with the deep, multi-directional architecture of the hip,
A command center.
right, or the complex, cable-guided tracking system of the knee, the core philosophy holds completely true for both.
It's a universal rule for the lower body.
You do not treat the joint in isolation. You work the green zones, the muscle bellies, to create slack and warmth.
Yes.
You absolutely respect the red zones, completely avoiding the tender ligaments, bony points, and tendons so you don't trigger that nervous system lockdown.
Do not touch the alarm system.
And finally, you utilize that newly acquired slack to build the strength that will actually armor the joint for the future.
Exactly. And before we wrap up, I think a formal disclaimer is absolutely necessary here.
Good call.
We strongly advise you to read both the full hip and knee management guides from N5 Digital and IsoTone carefully.
They are the ultimate source material.
Right. There are specific contraindications detailed in the texts. If you have vascular disease, a history of deep vein thrombosis or blood clots,
Very serious conditions.
yes, peripheral neuropathy, or if you have recently undergone surgery, you must exercise extreme caution. You need to seek direct medical guidance before starting any self-care regimen like this.
Safety first, always.
These methods are powerful, and they should always be used sensibly and entirely at your own discretion.
Know your own medical history and treat the source material as your definitive map.
Exactly. But, stepping away from the anatomy and the strict protocols for just a moment,
Yeah.
there is a profound psychological shift embedded in these guides that I think is worth sitting with.
I agree.
The text talks about rebuilding trust with your joints.
Rebuilding trust.
Yeah. Consider how much our fear of aging is tied to this idea that our bodies are just rusting mechanical parts destined for the scrap heap.
It's a very bleak outlook.
It is. But when you realize that your hip and your knee are highly responsive, living systems that will literally adapt if you just provide the right inputs.
It changes everything.
How did that change the way you view the next 20 or 30 years of your life?
It really takes you out of the passenger seat. You stop just waiting for the inevitable breakdown, and you become the active architect of your own mobility.
Exactly.
Such a powerful thought to end on.
Yeah.
Keep moving, respect the maintenance layer, and we will catch you on the next deep dive.